differential diagnosis from a C5, C6 radiculopathy versus a rotator cuff shoulder impingement. So the most important information I would gain to determine a differential diagnosis would be from my subjective. So I would ask certain questions like, do you have pain, or does it feel different when you have overhead activities? Is it hard for you to move your arm, or do you feel numbness, tingling, or radiating pain down your arm, which would be more for radiculopathy. So and then from that I would do my examination. So I would do active range of motion. I would do passive range of motion with overpressure. With that, that's when I would use my special test, which I would already see. So if I asked her to do abduct all the way up here, I could see if she has pain with a painful arc going down with shoulder impingement. And then I would do the Hawkins-Kennedy test on her for shoulder impingement. And then the inverse spinatus, my muscle manual testing, which I would do after all my active passive range of motion. And then for rotator cuff, same thing with abduction, ER, external rotation. I would observe painful arc going up and drop arm, having her go down during my range of motion testing. And then I would also see the inverse spinatus test with my manual muscle testing. So with that, too, you would also see isolated weakness. Versus with my radiculopathy, C5, C6, if they did tell me they're subjective, they felt radiating pain, numbness, and tingling, I would do the same type of examination. With my active range of motion, I would, in passive range of motion with overpressure, I would do the spurlings, which would be extension. If she felt pain with that, I would also do distraction to relieve that pain if she did feel better with that. And then I would do the upper limb tension test. I would also notice during my range of motion if she had ipsilateral less than 60 degrees of rotation. And then from there, I would check for sensation. So she would have a decreased sensation in her lateral arm and then her forearm and these two fingers. I would also notice decreased strength with abduction when I would be testing my myotones like that, perfect. And then also elbow flexion and wrist extension. And I would also see abnormal reflexes with her biceps and brachioradialis. From that C5, C6, you're going to see a lot of weakness in the muscles innervated by those nerve roots. So for those muscles, especially the rotator cuff muscles, the supraspinatus, infraspinatus, subscapularis, and teres minor, those are definitely going to be affected with all the other ones as well.